Welcome back to On the Beat, everyone. I'm over here with Dr. John Starr from Golden Triangle Periodontal Center. Welcome back to the show, my friend.
Thank you.
We have been talking all about gum disease and what you can do to fix it. Well, let's move on to implants. Okay, now there is a lot of changes that are going on out in the market with implants. There's been a huge shift.
Yep.
Okay, let's talk about what services you provide when it comes to implants, because are we still using titanium or is there porcelain now?
Now, there are some porcelains out there, but the
Yes.
jury's still out on that. So we prefer to use titanium implants that are coated with hydroxyapatite and tyenite, which is the same makeup as your bone.
Okay, can you just explain why you prefer to use that as a professional?
Because the body actually grows to the implant and becomes one with the implant. And the top of it's a screw and you put all kinds of attachments. And so when the patient's numb, you put the implant in, and then when the numbness wears off, the body doesn't know that anything has happened.
Yeah.
And so it doesn't ache.
Okay, well, I don't know whether you remember our parents or our grandparents would have full dentures, okay? Are they still happening? Is that still around? Because you see these ads on TV doing full plates.
Absolutely. We do lots of cases where we can take an edentulous mouth, no teeth,
Yes.
and put in 4 to 5 implants per arch with a U-shaped set of teeth bolted in place, or we can make some that snap in place. But the point is they don't slip, they don't move, they function like natural teeth.
And that's what we want people to understand. It's come so far now, hasn't it? There are so many options. Let's just quickly talk about the different options when it comes to, you were saying that you can put in a whole plate, you can do 2 or 3 at a time, correct?
Well, you could do conventional crown and bridge on top of implants.
Right.
If you're missing, say, 3 teeth, you can take 2 implants, replace 3 to 4 teeth with conventional crown and bridge on top. Or you could take all the teeth out and put the implants with a titanium bar. Now, all this is milled with computer technology. This is all very precision.
High tech.
Yes, very high tech. And you could literally come in, do a procedure, have a lab guy there, walk out of there with teeth that day. Now they're temporaries. Yeah, you can just do it that day, be temporaries, then you could come back in 3 months and have the final prosthesis put in place. But you can imagine somebody with a horrific gag reflex, for example.
Yes.
How are they going to have a chunk of plastic in the roof of their mouth? They
Well,
can't.
I'm thinking the same because I've got dreadful gag reflexes.
Yeah, well, you're not a denture candidate.
I'm not the perfect candidate. Okay, are they still lasting as longer than they used to? Because how often do we have to have an implant changed?
You know, we say a fixed bridge, which is crowned in natural teeth. The average
Yes.
life is 10 years.
Really?
Certainly there's some that last way longer. We say the average life of the implant is 20 plus years. You don't have decay issues, you don't have nerve issues for root canals. It's all in the supporting structures.
All right, let's just break it down. We do the implant, then we go back and have the crown?
That is correct.
Is that correct?
That's correct. You can put a crown on top, or you could put attachments that would snap, like a male-female that would snap on a U-shaped set of teeth.
Really?
Or you could have it where it literally has 4 screws, holds a whole arch of teeth in place.
Hasn't it
the
come so
size of an eyeglass screw.
Very quickly, do most insurances cover a portion of this process? or-
Most dental insurances will participate in the process these days, and that's
Okay.
part of our job, is figure out what it will do and won't do, and we plan all that out before you get it.
Oh, so as the customer, I come in and you do all that behind the scenes for us, so we
yes.
know what we're up for.
Yeah, before you ever tell us to pull the trigger, we have it all lined out for you, what you
What a
want
great
to do.
service you offer. Thank you so much, Dr. Starr. If you want to find out more information, it's all up on the screen for you right now. Golden Triangle Periodontal Center. They're going to give you all the information. As we were saying, the technology has come so far.
It really has.
When it comes to dental hygiene, gum disease. We can determine so much. Have those x-rays, have your regular checkups. We appreciate you coming back, sir.
Thank you.
Back after this short break, you are watching On the Beat.